Hello, we are broadcasting live from the CIRSE 2020 Summit studio. This is the wrap-up session of the third day of the CIRSE 2020 Summit. And I'm here in the studio with Pereira, the treasurer of CIRSE, and with Eric Verhoeven, one of the organizers of the Ideas Symposium. And Eric, I would like to ask you first, what was your impression of this first day of the Ideas track within the CIRSE 2020 Summit?
Well, thank you, Thomas. And indeed, it was the first day of Ideas, so all new for us. And I would like to start by extending my admiration to the CIRSE Vienna office for putting up such a wonderful program in less than 3 months. I think it's an exciting program, also the Ideas program. And the sessions today went very well, were very well attended without giving exact numbers. That will come later. And the highlights, even if not live, were again the case-based discussions. And you know that live, this attracts a lot of people. The room is usually too small for that session or those sessions. And we usually run around with a microphone to interact with the people, to ask them to discuss and ask questions. This was of course not possible, but even online and in a virtual reality, these were very good sessions. We had excellent cases, very interactive and teaching cases. The presenters did an excellent job, and the polling was very interactive and well taken. And I think everybody got a lot out of it. So a very good start with, again, as a highlight for the interdisciplinary aortic syndrome symposium, really the active participation and the fantastic cases.
And there's more to come, and I will ask you later on regarding the second day. But now, Felipe, we had a variety of things to choose, and one thing I would like to ask you is, we were talking about nerve blocks, and you said you were listening to that workshop, and I want to ask you about your impression. What was your thoughts? What were your thoughts on that? And maybe you could elaborate a bit on that.
Yeah, also, on an educational point of view, it was really very interesting workshop. And not only nerve blocks, it was also pain relief. So I could not discover, but have a very excellent overview on the different possibilities that from the interventional radiology, from pain relief to stabilization with screw, with cementoplasty, combining this different procedure with radiation therapy, for example. It was really quite absolutely interesting. The presenters, the moderation was first class, let me say, and I had the feeling definitively that they all have such a large experience. So the feedback for me from this session was excellent. The second message of this session was also that interventional radiology should be integrated in a multidisciplinary team for this patient with pain due to cancer, for example. And inside a multidisciplinary team, interventional radiology is safe and is very effective. So it's one of the conclusion I will take home.
Do you think we underestimate a little bit the importance of this?
I don't think. I'm sure, as an interventional radiologist, I have to say that not we underestimate what we can do, but I'm a little bit concerned that concerned for the patients that some colleagues are underestimated what we are capable to do, as I said before, with radiation therapy, with anesthesiologists, with systemic treatment. That's the reason this workshop was for me one of the highlights of the day.
Okay. There was also a workshop, not a focus session on pediatric interventional radiology, and I think this was important to the meeting. We all learned from that session that patients, children are different, and we need different vascular access, we need different way of dealing with the problems of trauma and hypertension. I was personally very amazed on the quality of the presentations there, and I think since we are so close in general interventional radiology, and sometimes general interventional radiologists are performing these procedures, we need to know what to look for, what is important in pediatric interventions. And I would like to ask Eric, you mentioned case-based discussion, but there was more to it on this first day.
Absolutely, and we started with the expert roundtable on the arch, which is a very difficult topic, but again it was highlighted that it is absolutely important to approach this pathology multidisciplinary, involving all people that are part of this treatment, radiologists, cardiologists, cardiac surgeons, vascular surgeons. And I think it's important to realize that we have many options nowadays, but that we need to find a tailored solution for each individual patient. So I think that session was extremely well balanced. Then we had more standard sessions on pararenal aneurysms, and the importance there was to understand that there are several options and that we also need to find the best solution for each individual patient. But what I liked very much about that session was that it was very balanced. Not black and white against an option and for an option, but accepting that not everybody may choose the best option or the one option, but sometimes has to choose another option. But all in all, it was extremely balanced and productive. We also had a Cook Satellite Symposium where 4 experts very honestly discussed the products, and in my opinion, very unbiased, with pros and cons and indications and maybe some contraindications, and where also the discussion highlighted the advantages of the products, but also the limitations of the products. So again, a balanced session. And finally, the planning session where people really discussed how to approach a pathology from the beginning till the end. The indication, the planning strategy, the needs to have a correct execution, all this together. And this session, an all-in-one session, would I say, this session was really very instructive and very practical, and that benefits to a lot of people, I think.
Eric, before you move on, because I would like to go back to you in a minute, because we are looking forward to the second day, and I want to have your opinion on that.
Of course.
Felipe, one of the important symposia today was on the CIRSE observational studies. This is a great endeavor. This is something new to society. Besides the results, the preliminary results which were presented today, it's important to mention that the place of societies in conducting these kind of studies is disputed, and maybe you can tell the audience your opinion on the place of CIRSE in this respect.
Yes, Thomas, thank you for the question. It's, as you say, very important, because it was a hot topic symposium on the CIRSE activities in clinical research, and it was really an exciting premiere from CIRSE to present, let me say, the achievements of many years of work. From CIRSE, with the development of a research department, with the infrastructures that are necessary to perform studies, with standardized procedure to collect the data. We have the presentation of the CERT. It's the largest prospective registry on radioembolization for liver disease. It's collected more than 1,000 patients, and you can imagine that you have a very large database, and you collect so many data that you can perform so many analyses from this data regarding radioembolization in the liver. Second talk was focused on chemoembolization with irinotecan chemoembolization. We know that we have a lack of data, and we address this problem, the lack of data in chemoembolization in colorectal liver metastasis. And this registry is already now the largest also prospective collection of data for this treatment, for the TACE in this patient. And Dr. Yetzi from Roma presented the interim analysis with 50 patients. We learned a lot, but we see exactly the place of chemoembolization in the armamentarium of therapy for this patient. And you know that oncologists are very active with immune therapy, chemotherapy, anti-angiogenic therapy, etc. So it's definitively a competitive field, but with this study, I'm sure that step by step we will improve the acceptance of this therapy. And the third talk was on CIRSE, also radioembolization for France, showing you another advantage of this registry study is to get a reimbursement also for special procedure in the interventional radiology. So you can imagine that with all the data, we will have another impact on guideline, we will have another impact of healthcare, regulatories, another impact in the interdisciplinary work. I believe it's a very hot topic, and it was really an interesting session today. Yeah.
Felipe, let me ask you another question on that. Now that we have taken this first step in doing these kind of studies, do you think we should that expand to other areas? Should that be the future? I mean, do we need more trials in a different area?
We should, you know, our CIRSE is a scientific society. Nobody can be at a better place to perform this kind of study. CIRSE is between the medical community, the industry, the healthcare societies. There is no better place also for the dissemination of the data, for the report of the data, for the transparency also, because it should be as transparent as other study. Our scientific society is really ideal to perform this kind of study. Yeah. And we have the infrastructure, as I said before. Now we have a research department with several very fascinating people who are working for that. And actually, the focus seems to be more on interventional oncology, but vascular is, of course, as you know, a big part of interventional radiology, and we will pursue this activity, of course, and maybe extending the field also to other part of the interventional radiology.
Thank you for this clear statement and the way we have
open to discussion.
Another topic today was the treatment of chronic and acute venous disease, and I think this was a very profound session. We had a deep insight in how imaging has to be done, how the access is, how to deal with the acute situation, what kind of measures have to be taken to make it a safe intervention. All this can also be seen on demand. As you know, all the sessions are on demand available. Eric, now, what can we expect tomorrow at IDEAS?
Tomorrow is a hot day, if I may say so, because we will start the day with the dissection pathology, and this is a terrible pathology, but also a pathology that attracts the interest of different specialties, and a pathology that needs a wide variety of treatments to benefit the patient. So I'm certainly looking forward to that session. Dissection in general has attracted more and more interest, and it's only slowly that we start to understand the extent of dissection. And I think it's also absolutely needed to pool data and results from all these dissection patients to move forward in the treatment of this terrible disease. And then, even more interesting, if I may say so, is the discussion on the Achilles heel of our endovascular techniques, which is clearly the durability. This was shown in the ongoing discussion with the nice guidelines that have taken many years to come out in a softer version. Whether this is correct or not correct, I leave in the middle, but it's certainly a wake-up call for all of us to find the correct indication for each patient and to be correct and cautious in the indication, because if we overdo the indication, no doubt will we see bad results in the long term. And these bad results in the long term can kill a technique and can kill many specialties. So we need to elaborate on that altogether. This is independent of the specialty you're working in. This is for all of us together to understand that we need to save, not the world, but endovascular in terms of applying the correct indication to the correct patient. And then we will go to another important range of complications when we use wires and catheters and we move up into the aorta, into the arch, into the heart, even into the ascending aorta. Well, no doubt do we face or do we have to fear neurological complications. And we will discuss all the neurological complications and certainly elaborate on the techniques we have nowadays to minimize them or prevent them. So this is the most important part, and then we have finally 2 sessions. One session is how to do it or how I do it, where experts will explain in detail how they treat a certain pathology. And finally, again, a planning session where we will go from A to Z to explain everything that is involved in the treatment of such a pathology. So I'm really looking forward to a second, a very important Ideas Day. And I'm very grateful that we are able to do this at CIRSE.
I think we probably have a lot to discuss tomorrow again. This was a great day. We had many people coming in, lively discussions in the different formats, and I just want to ask you to join tomorrow. There's another day packed with new sessions, packed with topics, packed with ideas, packed with embolization, you name it. And we all ask you to join tomorrow. Thank you for listening.